We're going to cross over to Milan. Rossella Miccio, the president of the humanitarian organization Emergency. She joins us now here on the News Hour. Rossella, thank you very much for joining us. Now, it has been reported that in the past, and we've seen this for the past several weeks, that Italy has really struggled to convince its citizens about the seriousness of this coronavirus crisis. I'm wondering, from a humanitarian standpoint, how much more difficult this makes the jobs of organizations like yours.
Well, good afternoon, everybody. Yes, this is a key issue. Actually, I think that worldwide we were surprised by this pandemic. Now, you were right before when you were comparing it to the Spanish flu after World War I. So I can understand that initially there were some resistances to deal with it in a more serious way. And particularly initially, perhaps there was not much attention paid to all the vulnerable and marginalized groups like homeless people or migrants that are living in our cities. And of course, when the main rule is to stay home or to call a doctor when you're sick and you have no home and you have no doctor to call, this is a problem for your own health, but also for the communities. So we immediately focused all around Italy, because we have clinics in several regions in Italy, and then particularly in Milan, that was very much hit by this outbreak. We focused on implementing surveillance measures and with the municipality, actually.
Okay,
to
Rossella,
make sure.
I'm sorry, but I want to sort of squeeze in one more question because we do have limited time.
Yeah.
We're obviously hearing reports of not enough hospital beds, lack of ventilators, protective equipment for healthcare workers. But on the other side, we're also hearing some very gruesome stories about old people being abandoned, being found dead in their beds at elderly homes. From a humanitarian standpoint, again, in terms, what does Italy need most?
Well, at the moment, we need doctors, we need hospital beds, because the system was actually overstressed, overloaded with the amount of patients that needed high intensive care. Therefore, the system was overstressed. And initially, there was a lack of protective equipment, of PPE for medical, non-medical staff, and this was a problem. I think that after this initial phase of, let's say, a bit of a shock, we are now being able to cope, and a lot of new efforts have been put into the response. Also, NGOs have been involved, us by the first, in supporting the hospital care. So I hope that now we will, our response will be more effective.
Okay. Italy is often referred to as being sort of the new epicenter of this coronavirus pandemic. In many respects, it's ahead of the curve when compared to other countries in Western Europe. I'm wondering what other countries can learn from Italy's experience, especially from a humanitarian standpoint.
Well, I think that everybody is learning from this experience. So what we are understanding in this outbreak is really that we need a comprehensive effort. So all the people, all the components of the society have to cooperate and have to do their own part. And we cannot leave anyone behind, because this disease, this virus, is showing us that there is no border, there is no rich or poor, everybody can be affected. So really what we need to do is respect rules, do our part, and look at the society as a whole, and trying to help as much as possible everybody.
All right, Rossella Miccio, thank you very much. Good luck with everything, and keep up the good work. Thank you.